have any question or you have contributions to make, give us a call on 027371619. In today's world, injury or ill health does not need to limit anyone from enjoying the work they have to do. When someone has become invalidated due to ill health or an injury, there are specialists who have the skills to help them get their lives back. One such professional is Marion Van Dyken, an occupational therapist from Cordon, a health service institution. Marion will be sharing with our listeners from her wealth of experience on the job. Our guest, Miss Marion Van Dyken, is an occupational therapist with Cordon, a public health institution. In 1999, Marion finished her study, ergotherapy, or occupational therapist, at Hogeschool van Amsterdam. She started as an ergotherapist and also advisor at Totimet, now called Mosaic. And in 2001, she joined Cordon. Her job is to rehabilitate people so that they can do again their daily activities. So, help me, our listeners out there, Radio Voice of Naija fans, help me welcome Miss Marion Van Dyken to the studio. Marion, you are welcome.
Thank you very much. I'm glad to be here.
Really, we are glad too.
And I'm a little nervous, but
don't be
no
horny.
problem.
You are here to do and to explain to us what you've been doing for years.
Yeah.
So true. I mean, you are in your field of honor and your field of expertise. Is that?
Yeah, it's
right?
True. I'm
so
getting old. Yeah. I heard 1999. It's a long time ago.
Yeah.
Yeah.
Well, it's gonna be a relaxed interview, and you will bring your best. Okay.
Yes, of course.
So tell our listeners why you chose the vocation as an ergotherapist or an occupational therapist. Why do you choose that?
I love to help people. I knew that when I was young. I was thinking about doing medicine, but it takes a long time and it's very theoretical.
Yeah.
So I was thinking, what can I do more, practical?
Yes.
So it took me a year to find out what to do, and afterwards I also was thinking about ergotherapy.
Yeah.
Because it's helping people with their health, but also learn them how to do it by themselves. So that's what I loved.
Okay.
And during the studies, I found out that's working. Yeah, it's nice to do it because I think when you're working in the health situation, in a clinic or something, it's easy to do everything for the people because we want to help.
Yeah.
That's I think our problem also. Yeah. Because I think it's not my life, but I can see and have a look in someone's life for a while and help them a little bit. So that's what I love.
Wow.
Yeah.
You see, you are really making a very solid point, and it's bringing me back to what the father who was part of the pastoral forum spoke about.
Yeah.
I think he was pointing to the fact that the people here have much love, and then for you to really commit your life to want to help people, it's so amazing. So it's amazing to me.
Yeah, it's a gift, maybe. Yeah.
So what exactly does your job as an ergotherapist or occupational therapist entail? Tell our listeners what it entails.
Yeah. What I do when people feel they can't do anything anymore, the daily activities, the practical activities like personal care, like going to the shop, going out, or use the telephone because they can't use their hands anymore.
Wow.
It's quite practical.
Yes.
I'm thinking about solutions how to make it easier for them, or when there are people who help another one, like your family, when you, informal care. It can be very hard to do it. When people can't do anything.
Awesome.
Yeah, when they are ill, it takes a lot of energy to
Yes.
help people,
Yes.
because when you have someone who you have to help him or her out of the bed,
Yes.
and someone can't do anything physically or
Yeah.
mentally, it's
Yes.
also very important.
Yes.
Then you find out, okay, what can the person still do, and how can the person help to come out of the bed. So when you do everything for the person who's sick,
Yes.
then it takes a lot of energy. But when you find out, okay, the person can move their legs a little bit, or can think about how to do it, then you do it together, and that's much better. I
Right.
hope I'm clear.
Yeah.
But,
Yeah.
so it's sometimes it's a technical way of
Yeah.
helping,
Mm-hmm.
and sometimes it's also about adaptations.
I believe by also technically involved, like I see you are trying to explain it,
Yeah.
be allowing or finding out which area that person who is sick can still function.
Yes.
I think is very important, because
Yeah.
sometimes we don't give them the time or the chance to exercise other parts of their body. So
That's
we,
true.
we quickly think they are just dumped and they can't do anything.
Yeah.
And then
Yeah.
yes.
That's
So
the
so
thing.
when we buy to that, we are already declaring them dead.
Yeah. And then you're taking it over.
Yeah.
But someone is still responsible. Also, if someone is sick, it's not always necessary to help totally. That's I think you.
Yeah, exactly.
point.
Yeah. So you have to assist to an extent.
Assist, yes.
Uh-huh.
And not take it over.
Yes, take it over. Yeah.
So I think that's the how do you say
That's the
uitdaging?
idea. That's the idea, the challenge, yeah.
Challenge.
Yeah.
Yes. Yeah, that's the challenge.
Yes.
But it's not only think about how to do, but also in what environment it's happening.
Yes.
That's why most of the time I go to people's house or people's work situation,
Okay.
because there it's going to happen and not in the clinic. It's so different, and if people doesn't want it, that's possible. Then they can come to me and to my office, and then we think about and discuss about. But for me, it's important to see what's happening and to look what simple things can make. So
Wow.
sometimes it's just one grip
Yeah.
on the right place, and sometimes it's just take your time to
Mhm.
help.
Yeah.
Yeah, so that's. But also for people who don't have help, there are many people who live on their own, of course, and they find out, oh, I have problems with doing my laundry or something,
Okay.
because I have shoulder problems,
Mhm.
and I
Okay.
can't hang them
Yeah.
up.
Yeah.
You see?
Okay.
So then you find out, okay, sometimes it's very easy. Everyone can think about it, but then you have to find something that's lower, or you have to think about, okay, first I do this, and then I rest a while, and then I do that, and I rest a while.
Yeah.
So I take more time. But for people who are very quickly,
Yeah.
I'm too, when I'm getting old, I have a big problem, because in your mind you're very fast sometimes,
yeah.
and then you have to think about everything, and that's very it's very complicated for people.
So under what conditions do people deserve your treatment? Under what conditions?
Under what conditions?
Yeah. At
In
what
which
point?
case
At what? Yeah. At what
can I
point
ask?
in time? At what point in time would they need
Okay.
your your service at what point in time?
That's a very
Because
interesting question.
yeah, because I believe there are some who are out there listening to us right now.
Mhm.
So and they may be very curious, just like me.
Yeah.
So at what point will they require your services?
Sometimes when you feel, oh, I need some help from another person for doing my daily boodschappen.
Yes, shopping.
Groceries. Yeah.
Sometimes when you think, oh, I can't do it, oh, leave it. I leave it now because
Okay.
I can't do it anymore. Or I have to find some other person who helps me, professional or informal. No, that's the same for me. And sometimes you should be earlier, because when people have dementia,
Yeah.
or it's starting,
Yeah.
in the first time you can't hardly see anything. It's just, it's going on and little by little. So when you think, or when people in your environment say, okay, I don't know how it's going with you, how you maybe you should ask help.
Yeah.
I think that's the moment. But if you're thinking, oh, I don't know exactly, then you call me, no problem, and I can think with you about it and say and give advice. Okay, let's wait a little, or maybe you can do that
Okay.
to change. So yeah, that's. I hope this is
Who
clear.
have benefited more from your services, the migrants or the Dutch? Who are your clients?
I think, migrants is a big group, of course. In this area, I work in this area, I live in this area too. But I think it mostly are Suriname people or Dutch people,
Okay.
and also African. Yeah, but I think we should reach more African people.
Yes. Is there any reason why you are not reaching them? Is it that they don't want to be helped, or what? Or they don't know about you either? Like, if I didn't explore, I won't even know that there's something called ecotherapy.
Yeah, it's true.
Ecotherapy, yes.
Ergotherapy is quite new. It's not really new, but most people know physiotherapy.
Yeah.
But ergotherapy, it's not known.
Yeah.
I think last few years, I think occupational therapy is getting more known, better known, because elderly people should stay longer in their own house.
Yeah.
That's what the government wants. So I think that's the way that we now are thinking about. Okay, how can we use occupational therapy for people like them? What was your question?
But not. I mean, who are more your clients? Yeah. Are they migrants or are they the Dutch?
Yeah. Both, but I think more Dutch people, because they are going. Yeah, the people who go to the health center. Yeah. They know us, and they know a little, and also people who are going to rehabilitate.
Yes.
In Gasperdam is a place here in the southeast.
Yes.
They know a little bit about ergotherapy, because when you break a hip, you need some advice from me.
Or when you have stroke.
Yeah.
When you have stroke.
Yes. Also, when you have stroke, most people go to Berkenstede. It's in Diemen, but also people come at our place. When you have a stroke or brain injury, then it takes a lot of time to rehabilitate. Yeah. Because it's also the brain damage. What's involved? What involves? How do you do your things? Yeah. Yeah. You have to think and concentrate, and it's not easy anymore. Yes. Or you can't remember how to do it. So then you have to practice and practice and practice and practice. But not only with ergotherapy, but also physiotherapy or logopedia, or of course the doctor is important. Yeah. Psychology. So those people know us.
Okay.
Yeah, but I think there are people who go to the doctor here in the health centers.
Yeah.
And they can find information about ergotherapy. But the only place they can find ergotherapy is in Holendrecht.
Yeah.
Because that's the only place where I work. And we like to do it on more places. But also like something like this is very important to us.
It is
the radio.
It is very, very important.
Yeah.
So what are the processes involved in your treatment?
First I go to people's house or they come in my place. And I interview the person.
Somebody who have stroke. How would they come? How would they come to you?
That's not easy.
Mm-hmm.
No. So that's why I mostly go to the people's house, and I may do that. That's very fun, very nice. I go to the people's house and just talk about what's important to them. That's not easy to answer, but when people have injury, they miss some normal things, like going to the toilet. It's so basic. But when you just can use one arm, how can you help yourself? It's not easy.
Yes.
Or when you have balance problems, then it's also hard to do. So when I talk with them, and also about what's your role in the household? Maybe when you have a family with family, and you are a mother with bekkeninstabiliteit, or back pain. It can be so much. Then how to help your children to go to school? Yeah, that's a very important question.
Exactly.
Or how can you do your cooking things? It's normally cooking. It can take a lot of time, but you can do very simple. But what's important to you? When you love it to cook, then you take your time the whole day. But that's not easy when you don't have energy.
Yes, exactly.
So we talk about all that things, all those things who are important, who are where you have passion for.
Yeah. Okay.
Yeah, and then the next time the first time we make goals. Okay, we want to reach this, or we want to reach that.
Yeah.
We want to. I want to visit my family in Rotterdam or something.
Yes.
Okay, how to reach it? So we talk about, and sometimes, or most of the time, I observe. I just look and see what people are doing, and that's not easy for people, because when people observe me, I'm going to do it the best I can, but I want to see the
what they
worst.
can do.
Yeah. So and sometimes it takes more times to observe.
Yeah.
But observing showering is, for some people, they don't like that. So then you are talking about and to okay, I'm going out of my bed. I have to replace the
beddings.
The beddings. I have to stand up out of my bed. Oh, that's very difficult. Maybe the bed is too low, or maybe you feel I have to sit and rest a while.
Yeah.
Okay, step by step.
Yeah.
We talk about, or I watch. So it's sometimes details I see.
Yes.
Yeah.
Exactly. Wow.
How people stand, how people move, and also how people organize in their head. That's very important too. When you're getting older, you do many things automatically.
Yeah.
Me too, but when you're getting older, it's more important. It's also the brain organizes it in that way, because it takes less energy.
Yeah.
So when you do things automatically, then you do it and just don't think about it. And when I'm with someone, we have to think, okay, step by step, how am I doing it?
Okay.
So, and the last time then we try to find solutions for the problems. So some people know their solutions, their own solutions, and some people need to be helped with it. So sometimes adaptations, sometimes help aids, things to help. Little things like when you eat with a fork and you can't reach your mouth, maybe you use another spoon or another fork.
Yeah.
Yeah. So
Wow.
I can't stop telling about it.
Wow.
Yeah.
It is so demanding, eh?
Yes.
It's so
It is.
demanding.
Yeah.
A very hard profession you have.
Yeah.
It can only take somebody that have the passion for it, that can do it.
Yeah.
Wow. Well, some of you out there listening to us, in case you would want to make contribution, or you may want to give us a call to know more about what Mayan is speaking about, you are free to call us on 020-737-1619. This is so interesting. Don't just sit down there, even if you don't want to mention your name, just give us a call. I believe that some of you have people who need this care. You need to help them. So you see, the world today is making things very, very easy. So we have all of these professions, and we are committed to bringing the experts to you so that we can also be a blessing to you and your family. So take this opportunity and get to know more about what ecotherapy is all about. Thank you. Maya, before we take a short break, I would like to know how good are the results of your therapy, and within which space of time can we begin to see a positive sign on the patients?
I think it depends on what's the question. Sometimes when you have a simple solution, it's in 1 week or 1 day, and then it's the effect is
visible.
Yeah, visible. Thank you. But when also a great thing of my job is to ask for adaptations in the house, and that will take a long time sometimes. Sometimes it takes weeks, sometimes it takes months.
Okay.
Like an elevator on the stairs, you know, we have to motivate why it's necessary. Like people, when they want to go really from downstairs to upstairs, I know it's important to people, but also the local government has to know why it's important to that person. So then I have to motivate. I have to explain why it's important. So that takes a lot of time sometimes, but we have to wait before the adaptation is finished, because there are also people who need to place it.
Okay.
So sometimes then it takes a few months for that thing.
Okay.
It's people. Sometimes people want to have results immediately.
Yeah.
And that's I understand. That's
like people who have stroke.
yeah.
So how long does it take you to really help them, and then they are able to begin to use that part of their their body that have been stroked?
Yeah. Most of the time that's in the hospital. Then you have then you have therapy every day, sometimes a few times a day. In 6 weeks, normally you should be better, but then it takes time for get the power and the energy and how to organize everything. So then it can take half a year and sometimes a few years. But the stroke is a very, very big thing. Yeah, because your brain organizes everything. So when there's something happening in your head, then it also takes a lot of time. But that's the training thing.
When you see a patient like that, or you are being called for to handle people like that, does that scare you? Does it scare you? Does it put
sometimes.
you off? Does it put you off because you see it like, oh, this is gonna delay my profession, it's gonna delay my job?
Sometimes it scares
you are being put off?
Yeah. Yeah, because also when people expect something very fast, and I know, okay, it takes a lot of time. It's not easy to tell, and I have to tell it. But I also have to, when I tell it's not going to happen, who am I to say that? So sometimes it's not necessary to tell. Just walk side by side and find out together what's working and what's not working. So that's, but it's also depends on the household from someone. Because when you are a partner from a person with a brain injury, then it takes more to help and to give a company to the person.
Wow.
So that's important too. It's not only the person with the brain injury or with a stroke, it's also the partner or the children, and they have to find out together how to do it and how to deal with it.
Yes,
and I think it's a big issue, but it's also, I've seen people who did it very, very good. Oh, I was wondering how did they make it to help and to do everything together, and they were agreeing with each other. So we do it like that. Yeah. Awesome.
Well, we'll be taking a very short break right now. There's somebody who is out there. Remember, the topic is on rehabilitation, life after injury or ill health. In case you have a patient, you have a loved one who needs this service, please feel free to give us a call right now on 020-737-1619. An expert is here in the studio to handle any sort of question you may have. Marion van Dijken. Marion, welcome back.
Thank you.
Are you enjoying it?
Yes, I love it. I can't stop talking, you know.
I believe you are now relaxed because you were nervous.
Yeah,
but now you are relaxed.
I am really relaxed. Yeah. Time flies.
We are so committed in making our guests feel so relaxed. Most of the time when I go out to bring them, even the doctors, the professors, they will say, "Oh, I'm so scared. I would like to talk to 25,000 people at the time." No. I say you don't even see them, but they are listening. They are listening. So we are so talented in making you feel relaxed when you come to us. And then you bring out your best.
Yeah. And I know I think it's important to tell about my job.
Yeah,
it's just for me.
Otherwise, nobody will tell that job for you. You have to do it by yourself.
It's true.
Okay, so how much does the treatment cost? And is it covered by health insurance?
Yes, it is. I will start with that because that's the best thing I can tell. Health insurance companies will pay for the ergotherapy for 10 hours a year. But when you have your own risk, $350 a year, then you need to use that first. So that's for every specialism or medication. So when you already go to the hospital and have medicines, then it's for free, ergotherapy, and other. Yeah, wise you need to pay the first $350 and then it's paid by the insurance company. Yeah, and I'm glad because there are so many therapists who find out that people don't want to pay for it because there's paid a lot for the people here. Yeah, and now the time is changing. Okay. So we have to pay by ourselves more and more. Oh. But ergotherapy is still paid, so I think you should take it now. Yeah, exactly. Yeah. So they are entitled to have 10 hour session. 10 hours a year. Yeah, and it's most of the time it's okay. It's enough. But it's that's when I treat people at home at their homes. But when you're in the hospital, it's different. It's paid by ABBZ. You know that? Right. So what you're trying to say, Marion, is that I can just decide now, and then I say, my hands are a little bit, so I would like an ergotherapist. Yeah. Can I say that to my doctor, and then the doctor will quickly recommend me? Yeah, the doctor can give advice to go to the ergotherapeut. Yeah. But people can also come at my place or call me directly. So it's not necessary anymore to go to the doctor first. Mm-hmm. I have to report the doctor what I did.
Okay.
So that's important. But it's very easy to come and to call me.
To call
problem.
you.
Yeah.
Right.
I can give the number if it's necessary or.
Yes, it is necessary, but the fact is that we've been asked not to be taking number direct. What's going to happen is that you gave me the number, and then those who are interested, they have to call Radio Voice of Naija. In case you are interested and you want to reach our guest, you need her services, please just give us a call on 0684606550. I will surely give you all the contact number of Miss Marion Dijken. Van Dijken.
Yeah.
Right. So I repeat, our number is 0684606550. This is the number of Radio Voice of Naija. So you give us a call, and then we will give you the every contact of Marion. Is that okay, honey?
That's very, very good.
Yeah.
And they just can call me. It costs nothing. So just call and ask if it's, can you help me, or can't you help me? I can say, oh, that's a good idea,
Yeah.
or no, it's not, you can better go to someone else.
Now, before we even sign off, for people seeking a career in your field, what are the basic qualifications?
That's a very important question. It's getting more and more important. Yes. People, ergotherapists are qualified when they are when they have there is a quality register.
Okay.
So you have to fill in your name, and you have to do course every year, and then you get qualification. You need to develop yourself, and if you don't, yeah, then there are other people who are better.
Wow.
So, yeah.
Really? Well, we are going to take this news for just 1 minute, and then Miss Marion Van Dijken, an ergotherapist. That means occupational therapist. My last question with you, honey, is we wanted to know the qualifications of the people.
Yeah.
Those who may want to have such a career.
Okay. Sometimes the one who teach me.
Yeah.
She said.
The one who taught you.
Yes. She said, if you like everything and you cannot choose, then do occupational therapy, because it's so different. Every situation is different.
Okay.
Every man or woman is different.
Yeah.
Everyone has a different life, and that's the most interesting thing of my job. So if you love people,
Yeah.
and you love how they act, and you believe in their possibilities, then
That's awesome.
be an ergotherapist. Yes.
Yes.
Yeah.
Yes.
Yeah.
I think it will be very fulfilling. It's a fulfilling career, because many people sometimes here they walk, and then they say they have problem with their knee or their hand or whatever, and they stay at home for a long time.
Yes.
But now, with people like you around, people with your profession, they cannot make those excuses anymore.
No, it's true. It's true. When they want something, they make contact,
Yeah.
and we find out what's possible. Because when you think I'm not worth it doing anything, or I feel pain, it's a problem. When you have pain, it's invalidating. So then it's it's a good job to find out, okay, but what can I do? What I still can do? Maybe I can do the painting thing, or maybe I can find some other hobby, or I do something for one another. It's also possible.
Wow.
I love it. I hope there will be more people who find what they can still when they have a disability or handicap. Still, do what you like, and do what you give some energy.
Yeah.
Yeah.
Exactly. Well, we are almost coming to the end of our segment with you. But in a nutshell, what extra information would you want to leave behind to our listeners who have heard you today?
I think I think what I said is the most important thing. To believe in what you can and not only think about what you can't.
Mhm.
And I also think find out when someone in your neighborhood is changing,
Mhm.
like in acting. Find out what's the reason, what's the problem,
Okay.
health problem. Because when you know what's happening with someone, then you can find out, okay, what's working, what kind of healthcare I
Yes.
can give, or not only healthcare, also care from other people,
Yeah.
not professional.
Okay.
So I think it's good being informed about mental diseases or physical diseases,
Mhm.
and go to your doctor and ask not only for medicine but also for how can I deal with it? How can
Yes. Exactly.
That's what I want to say.
Thank you so much. Thank you so much, Marion. Thank you. It has been a pleasure having you.
Yes.
And we think this is a beginning of a new relationship. I believe that we would like to have you again and again and again.
I would love to. Yeah.
Thank
Thank
you.
you very much.
And those of you who are